Hi, I'm Mark Stiles, one of the founding members of Cambion Wellness. I'm here today with health educator Dr. Mache Seibel. He's a professor at the University of Massachusetts Medical School and founder of Health Rock. Dr. Seibel, welcome.
Thanks for having me.
So we're here today, Dr. Seibel, to speak on andropause, menopause, men's menopause. I have to be honest with you, Dr. Seibel, I've never heard of it. What is this?
I will tell you this, the guys that have heard of it are keeping it a dirty little secret because no one wants to talk about this, you know. But the actuality is that although it's different from women who are, of course, biologically have periods that stop when they go through menopause, men don't have that situation. And men are able to have children even though they get older, which women cannot do once they get into their older age. But what does happen is for about somewhere between 30% and some people think 100% of men do go through a decline in testosterone. And a matter of fact, if you look at the hormone levels as the main indicator, because this is the main indicator that we test for, a man's hormone levels will be at, say, about 900 units at the time of their 20s. By the time they hit 50, they'll be down to about half of that. By the time they get 80, they're going to be down to about 10% of that. So there's
10%.
So there's quite a decline in testosterone with age, and that's basically what happens.
So what are the symptoms, and when would a gentleman start to feel the symptoms of this menopause?
Well, at about age 35 or beyond, testosterone is on a rather steady decline of about 1.5–2% a year. So sometime in the 40s, 50s, 60s, more commonly at that age, 60 and beyond.
Okay.
But sometimes it could be a loss of interest, a loss of libido, it could be irritability, it could be tiredness, it could be loss of mental acuity, not really wanting to get up and do sports and things like that, manly kinds of things. You know, it could be a whole host of soft symptoms that are not necessarily apparent.
Now, is there anything that we as gentlemen in our early 40s could do to prevent or to kind of stave off some of the symptoms that we are talking about here with this andropause?
Well, one of the most important things I really think is going to the doctor. I mean, one of the things that guys do not do is they do not go to the doctor. Man, this is one of the big issues right now in healthcare. Guys will, put the hood of the car up. They'll sit around and talk. They may discuss a few personal things at that time. Maybe they'll talk about it in the gym or something like that. But guys don't go. So go to the doctor. That's number one. Number two, if there's been a real change, and a lot of times one of the things that a lack of testosterone can do, it makes your muscle mass go down. Because testosterone, the guys that are taking those steroids are taking those testosterone-like hormones to build up their muscle mass. So andropause can be associated with a loss of muscle. So working out is very good. Bone health can also be affected. So guys may start to get more likely to get osteoporosis. They may have a change in their hair. There's a lot of things. They may start to get fatter, more truncal obesity, more around the belly. They may start to get breasts. And I don't mean like a woman, but I'm talking about, you've seen guys who are really fat and they get that what looks like breast, so breast tissue. So you see these kinds of things. Get a hormone level. Talk about it with your doctor. A loss of libido could be another reason. It may not be something that you need Viagra for. It may be something that you need just to check your testosterone level and supplement.
So are those two things, do those go hand in hand? Is that we're seeing all the commercials for the Cialis and the Viagra that you speak to. Do those go hand in hand? Is that part of andropause, or is that something separate and distinct from andropause?
If a guy has andropause and has low testosterone, then giving testosterone is something that's going to help. Now, there's a couple of things I want to mention about testosterone. I mean, you shouldn't take things that you don't need. And how do you know if you need it? Well, if your levels are lower than they're supposed to be for your age, then that means that you would benefit from it. But if your levels are pretty much normal, taking more of it is going to lead to the side effects of testosterone. And the side effects are pretty important, guys, because they can cause you real harm. If you are a guy who has cancer cells in his prostate, the testosterone can stimulate that. If you're a guy who doesn't have that, but is just starting to notice you're getting up at night, going to the bathroom a little bit more often, then the testosterone will stimulate the prostate gland, which surrounds the urethra. The urethra is the tube that goes through the penis that we urinate through. And in the back, there's a little walnut-shaped gland called the prostate around it. That will swell and eventually constrict it so that it's not easy to go to the bathroom. And it can also increase your blood count to levels that thicken the blood. So there's some negative things from taking it, and may even can cause heart damage. You know, for instance, Arnold Schwarzenegger had these angioplasties and so forth not so long ago, and probably it was from taking steroids. We're going to make a guess about that. So these are not necessarily all good things. So everything has to be under a doctor's care.
What's the difference between testosterone and human growth hormone?
Well, growth hormone is a hormone that we all need in order to grow up because it is, quote, growth hormone. So when we are little, growth hormone is really essential for building up our muscle mass. It's going to get us to get taller. And for some people in the health industry will try to tell you that it's good for, you know, keeping you stronger and fit and younger. And
the fountain of youth,
right? The fountain of youth. You know, it would be great if it were that simple. The thing about it is that in adults, growth hormone declines down to very, very low levels. And so it is normal to have very low levels of growth hormone. And there again, if you're somebody who is deficient in growth hormone, then you need that growth hormone in order to sustain your body, to make it grow, and so forth. But probably an example of growth hormone, the biblical example would be probably David and Goliath. Goliath was probably someone who had too much growth hormone. A lot of people will remember Andre the Giant, who was the wrestler.
Yep.
That is the outcome of too much growth hormone. If you notice, his hands were huge.
Yep.
He had that bony protrusion in his forehead. The tongue gets a little thicker. The jaw starts to stick out a little bit more. It can cause thinning of the bones. It can cause heart disease. So all I can say is if you're someone who's thinking about taking growth hormone and you don't have a deficiency of growth hormone, be sure and discuss this with a medical expert in this area because you may be doing yourself a disservice and aging more poorly.
And how would you know, is there a blood test that determines whether or not your testosterone and human growth hormone levels are high enough or low enough to determine whether or not you need some additives or subsidies of these?
Oh, absolutely.
Okay.
It's a simple blood test. You get a blood test, and now testosterone comes in two flavors, if you will. There's the total testosterone and what's called the free testosterone. So I'll just explain that real quickly. Total testosterone is the total amount of testosterone that is in our bodies. Now that amount is typically 99% bound or attached to a hormone called sex hormone binding globulin. And this sex hormone binding globulin, or SHBG as it's abbreviated, attaches to testosterone and it attaches to estrogen. That's why it's called sex hormone binding globulin. Why does it do that? Well, because it is not so efficient if we need a hormone to just start manufacturing it. Think of it as a company. If you wanted to have something that you manufactured delivered, you'd have some of it out in a warehouse someplace, and then you could ship it real quickly. You wouldn't have to just, turn on the flames and the fire and get it going. So the body does that with these globulins, these proteins in the bloodstream. Now, 1% of the blood contains testosterone that's called free or unbound. This unbound, this 1%, is the only part that is biologically active. The rest of it is like unavailable to our cells to make a biologic effect. So what happens in andropause is some people will have an increased amount of this binding globulin, and that will lower their free testosterone or unbound testosterone. And so in essence, what they have created is a reduction. And so that is a way that you can measure. You can measure the total amount, and you can measure the unbound or free amount.
So what would the treatments be for both this SHBG and the andropause for a gentleman who's diagnosed with either one?
Well, there would not be a treatment for the SHBG unless there was something else you were taking that was, affecting that. But in general, the treatment would be testosterone, and testosterone can be given in a variety of ways. You can use it as a gel. You can use it as a patch. You can use it as an injection. Most of the time, people don't take it as a pill. I mean, we like to take pills, but it can cause liver toxicity as an oral medication, so it's not given. There's some disadvantages from taking it as an injection because you start to get a very high level initially, and then about over the next 2 or 3 weeks, which is how long it lasts, you start to get these low levels. The issue with gels, which is important, is the fact that, as you might imagine, you've got a substance that's hormonally quite active on your body. If you have a partner or a child and you rub up against them, there's some risk that that could rub off on your partner or your child, and that could cause masculinizing kinds of activity in those individuals. So every one of them has give and takes that you have to be aware of, but as far as resolving the problems, it will take care of getting you a good dose of it.
Okay. So what is it that we can do to help prevent or to help be prepared for the inevitable andropause?
Okay, well, I think those are important things to talk about. Number one, be physically fit. Stay active, eat healthy, control your weight because obesity contributes to it. Bad heart disease contributes to it. So anything we do to improve our general weight is going to be helpful. Diabetes contributes to it. So anything we can do to control our blood sugar and to keep our bodies healthy. So basically, the healthier we are as individuals, the healthier we're going to be in terms of avoiding andropause and all the other associated things that go with aging.
Well, that's great, Dr. Seibel. I appreciate you coming. That was some wonderful information about andropause, and I appreciate you coming today.
Thanks so much for having me. Appreciate it.